effusion. There are two views you can use to assess for pericardial effusion. These include the peristernal long and the subcostal view, which tends to be the more sensitive view. First, thinking about the peristernal long. The pericardial effusion can be found in two places. It can track anteriorly towards the top of the image and more inferiorly towards the bottom of the image. One of the things that can often trick you is if a patient has a pleural effusion, you may mistake this for a pericardial effusion. What we're showing on the image on the left is a pericardial effusion, and the image on the right is a pleural effusion. How I know the image on the left is a pericardial effusion is when I look inferiorly, I see that effusion tracks above the descending thoracic aorta, which we mark here. In contrast, in the image on the right, when I look at this particular image, the effusion, or fluid, is directly in contact with the descending thoracic aorta, which makes sense. If you think about the aorta, it's in the chest wall cavity. If there's fluid, it should be directly contacting it. So be sure to distinguish from a pericardial and pleural effusion using this technique of tracking the descending thoracic aorta relative to the fluid. Next, let's discuss the subcostal view or subxiphoid view for pericardial effusion. As I mentioned, this is one of the most sensitive views, and generally you can get a quick assessment of the effusion by scanning the patient. Here we see an image of a pericardial effusion surrounding the entire heart. You may hear about assessments of right atrial collapse, right ventricular collapse. These are things that are a little bit more advanced, and generally the assessment of pericardial tamponade or hemodynamic compromise is beyond the scope of POCUS. You should just incorporate POCUS into your clinical exam before determining if an